everybody.
Hello.
Thank you for joining us tonight. And for everyone watching at home on Facebook Live, I'm hoping we're live because it's telling me we're live. Sorry for being a little late tonight. I've been telling everyone that we're on Drag Central time, so some of you out there know what that means. It's about 20 or 30 minutes late. So tonight we are talking about LGBTQ health. We're talking about HIV/AIDS. We're going to talk about some COVID-19 issues, and actually there are a lot of other good things that we're going to be chatting about. And I wish were broadcasting earlier, because as we were just chatting about what we're going to chat about, such a good conversation. So I would like to go around and introduce everybody. For those of you watching who don't know me, I'm Chris Gossas. I'm the president of Rainbow Pride of West Virginia. And with us today, we have Dr. Christine Teague. She's with the CMC Ryan White program. She's the director there. We have Dr. Angie Settle with West Virginia Health Right. She's the executive director.
Hello, thanks.
We have Chuck Anshulevich. And Chuck, I can always say your name perfectly, but when I read your name and say it, it always throws me off a little bit. But I'm sure you're used to that, right?
Right.
Chuck is an HIV prevention specialist for the West Virginia Bureau of Public Health. And then we have Kay Albright, and Kay is a case manager at the Covenant House. And every time that I'm on a chat or a meeting or in public with Kay, and Kay gets tired of hearing me say this, but Kay said something to me a few years ago that has just resonated with me. We were talking, it was toward the beginning of my work with Rainbow Pride. And what Kay said to me, we were just having a conversation, it just resonates throughout my entire life. Kay said, never underestimate the power, the ministry of presence, of just being there, of just showing up, of just lending an ear or a shoulder. I mean, so I think that concept, just being there, just showing up, is impactful. So thank you for being here and showing up and helping kind of get this information out to folks. I think it's a conversation that more of us need to have. And the goal is we're going to have a casual conversation, gang, out there watching. So, sit back. For the record, this is water in here. So, so if I take a drink, it's water. So I'm going to let everyone just kind of talk about what you do with your respective, specialties or places of employment, and the services that you all may offer and whatnot. This group is so interconnected, as many of our social advocacy nonprofits, and we're just so intersectional, not only just within our own community as far as the diversity with, transgender folks, with our Black community, our lesbian community, and, it applies with our health community as well. So, and our faith community. And so I'm excited. So who would like to go first?
Christine, you'll go first.
Yeah, I'll jump in, and and yes, I would wholeheartedly agree that everybody on this call, there's really not many days that go by that we don't have some interaction. It may not be directly the four of us, but I know that all four of our organizations are constantly collaborating together on projects and patient care, the client care. So, I think it's really appropriate that we're all here to talk about our various perspectives on things. But I'm Christine Teague. I work at CMC at mainly the Memorial Hospital with the Outpatient Care Center and with the Ryan White program. I'm the director there. And we basically we're part of a large federal grant program that allows us to get support funding to help take care of people who are impacted by HIV, infected with HIV. or we can also do what's called early intervention services, or work with people who are at high risk for HIV to do testing and harm reduction or risk reduction, as it's commonly known. And we serve 19 counties in the southern part of the state. And so we have patients that are enrolled in our program that come from Charleston, of course, but we have people that come as far away as Bluefield, and it's Braxton County on down. We don't cover the Huntington area. There is an infectious disease practice there that will probably be applying for some Ryan White funding this go round. And there's also a Ryan White program similar to mine that's in Morgantown at WVU. And we have about 400 people that are enrolled, and we do adult care. So our youngest client or patient is 18, 19 years old. And then our oldest is 80 plus.
Wow.
So we have a wide variety of age ranges that are represented. About 80% are men, but we do have 20 to 25% are women. We've had, in the last 20 years or so, we've had probably 10 or 15 women give birth to babies. And we have a fair number of African Americans, and that number has been consistent, about 20 to 25% over time, and about 75% identify as LGBTQ. So, we've focused a lot on LGBTQ populations. We do have more people who identify as transgender that are in the program. And we also have been focusing a lot on not only sexual and gender minority populations, but also with people who inject substances, because that is now actually the most common risk factor for HIV acquisition in the state of West Virginia is through injecting drug use. And of course, that can overlap with LGBTQ people. And that's where a lot of our collaboration now in the community with West Virginia Health Right and Covenant House are focused on working with those high risk populations. So that's kind of what I do in a nutshell. Also, just to let you know that our funding not only covers HIV specific care and medications that go along with HIV, but it's really the whole disease process and whole aspects of primary care, mental health care, dental care, support services, including a food pantry, case management. So it's everything to support somebody that is living with HIV disease. And it's not just seeing a doctor and getting your HIV medication. It's far reaching. And one of the things that one of our biggest challenges is keeping people engaged and in care. Mm-hmm. And so a lot of the support services are built around identifying barriers for folks and ways to keep them maximally engaged in their care for the best possible outcomes. Right. And I'll stop there for now.
There's so much to get into.
There is.
I'm taking notes here, and I'm like, ooh, I want to ask about this. Or who would like to go next?
I'll go.
Okay.
So I'm Angie Settle. I'm the CEO of West Virginia Health Right, which West Virginia Health Right is the state's oldest and largest free and charitable clinic, basically founded on the premise that everyone should have access to health care. We do cater specifically to those that are underinsured, which would be Medicaid or Medicare patients, and those without insurance. We like to reach out to those people who otherwise would not be able to access care, and we include LGBTQ in that population. A lot of times they have issues accessing care, and we always want to have a open door welcoming policy to everyone and help meet their needs. So we do medical, dental, pharmaceutical, behavioral health. We have health education. We actually have a program specific to LGBTQ. I don't know if you're aware, but LGBTQ have a higher rate of smoking than the straight population. So right now we have a campaign going out to actually try to recruit more people for the tobacco cessation program that we have. There'll be some commercials airing for that. We have a big health education program, a mobile dental program, a lot of outreach Probably the thing that we've got most involved in over the past year, of course, is doing a lot of HIV screening, working with Christine and the Ryan White program, just getting out there in the community. We've done about 2,000 HIV tests in the community. And as she mentioned, heightened concern because of the substance use disorder. Even for those that don't personally have a substance use disorder, it's something we need to be aware of in terms of the dating scene, etc. That, you know, a lot of times people are highly functioning drug users and you can't always tell. So you got to be very careful about that. But to the Covenant House connection, we opened a clinic there full time Monday, Friday, 8 to 4. And we're there on site, and we actually have a very pro LGBTQ provider there who is ready and willing to see people. And what we're doing a lot of pushes for PrEP. We want to offer PrEP there at that clinic and our main clinic because we want to do as much prevention as possible. So we're able to help get that for the uninsured population and then those with Medicaid or Medicare. So a lot of preventive work in the community, and we see ourselves as advocates and want to make sure everybody knows that they're welcome to come to us for care.
Wonderful. I'm taking notes. I'm jotting things down here. And I love that you mentioned PrEP, because I think that's something that in our region is so under-discussed and underutilized, but we can get, I mean, it baffles me at times, but
Yeah.
Chuck, would you like to go next?
Yeah, sure. My name is Chuck Anzelevich. I have been an HIV prevention specialist for almost 34 years. Well, no, 28 years, something like that. Anyway, I've been working for the state for a long time. I started working with the West Virginia Bureau for Public Health in HIV prevention back in 1992. Back then, there was a real sense of emergency. People were dying right and left. I mean, I was going to several funerals a year. And I started doing this work. And when I first started off, I was traveling around the state doing presentations for high schools, colleges. High school teachers were inviting me to speak, and they were saying, these kids don't know what's going on. You have to talk to them, you know. And so I was doing a lot of that. My first work was doing a lot of educational stuff. And then I started learning how to do HIV testing and counseling. And so most of my work these days involves HIV testing and counseling, and also teaching other healthcare professionals the finer points of HIV prevention and counseling.
All righty. Kay, would you like to go?
Sure. I want to start off by saying that Covenant House is a safe place for you to be who you are, no matter who you are. Covenant House is that place that you can come. We have a number of programs, but we have one program that is, our philosophy is that you have to have housing first to care about your health. You know, you can't really care about your health. So we serve, you know, people who are homeless and underhoused, to give them a place to live. And we have a special, some special grants for people living with HIV and AIDS that are low income and whatnot. Covenant House has become such a place of so many things, and the health right is an important part of what we do. It's a godsend. So that's what we do.
Wonderful. Well, again, thank you all for being here. Maybe just to start our conversation, a couple things that I jotted down, and of course, my perspective as a now 47-year-old cis white gay male. Aside from testing, because I think at one point we need to talk about June 27th being HIV/AIDS testing day, as Chuck so wonderfully has given us some promotional materials to kind of get the word out. But one thing that has struck me over the years, because I'm not a native to West Virginia. This summer will be my 13th year here, and now I recognize so much has happened in those 13 years when it comes to HIV/AIDS and preventative measures and whatnot. But even when I go to other cities and I'm interacting with folks there, PrEP is more commonly discussed. PrEP is more commonly prescribed. There are more physicians in other more populous regions that are familiar with PrEP. And here, I think I get as many people who know about PrEP as who don't know about PrEP. And also I hear about family doctors who don't know about PrEP or aren't familiar with it. Mm-hmm. So I don't know, maybe do we want to start talking about prevention and things like that?
Well, PrEP is something that we've been really trying to promote a lot more. I know somebody who was very active in the gay community here in West Virginia, and he lives elsewhere right now. And I ran into him one day, and he said he was on PrEP, and he said it made him feel much more confident, was his word. Mm-hmm. There are a lot of doctors in West Virginia that can prescribe PrEP, and it's something we're trying to promote a lot more.
Yeah. And I think a lot of people don't realize in the medical community as well is that anyone who has prescribing privileges can prescribe PrEP. It doesn't have to be a physician. It can be a nurse practitioner or a physician's assistant. I think some of the obstacles to us getting the word out, there have been a couple of different things. One is that, interestingly, my program, the Ryan White Grant Program, we can't use our funding for PrEP. Right. We can use it for treatment and we can use it for care of people who are infected, but that is actually one of the big no-nos, is that Ryan White funds are not to be used for PrEP. We can navigate people and their partners to PrEP, but that's been one obstacle in terms of messaging. And the other thing is that because HIV in West Virginia is a lower incidence and prevalent state, meaning that we don't have as many cases or as many cases per 100,000 population as do many other states. Mm-hmm. The drug companies that manufacture HIV medicines or preventive medicines, they're not as invested as to come to West Virginia to speak to West Virginia providers. That's another barrier. And that just HIV education in general for medical professionals is, it's a very small piece in medical training. And I think in West Virginia too, that's a bigger issue. We do have an AIDS education and training center that's located in Morgantown. Every state has what's called an AETC, and it's a type of Ryan White funding. They get specific money to go, and that's what they do, is they educate healthcare professionals throughout the state, whether that be physicians or pharmacists or dentists, about HIV. And they do a good job with prevention and overall treatment messaging. But we still, I think, have a ways to go. And PrEP is not a new thing. It's been out for probably close to 6, 7, 8 years now that we've been talking about it. But still, I think the majority of individuals who are at risk and healthcare providers are still not where they need to be in terms of uptake with it.
I agree with that. As a board certified family nurse practitioner, I've practiced 23 years, and I feel like part of the issue is we're failing the population, not having the conversation. A lot of times it's not always comfortable. And I think it's important that those in the LGBTQ community feel close enough to their provider to talk about such matters. A lot of times, it's, and, feeling rushed coming in for whatever issue, blood pressure, whatever. It's not always brought up, but I feel like.
And sex is hard to talk about.
Sex is hard to talk about in general. I mean, even if you have a man come in for erectile dysfunction and they're asking for a Viagra or whatever, sometimes that's a hard conversation to have. I also feel like just making a similarity to conditions like Hep C, where a lot of times it's kind of segregated off from the person, where a lot of times providers want to refer out for that kind of care, or they feel like they want to just stay in their main primary care lane, and they think, oh, that's infectious disease, or I think that we need to promote
but it
more.
Should be primary care.
And it should be primary care. I agree. So I think that's great. But I've learned this for my own self, my family members. You have to be your advocate.
Sure.
You got to demand that care. If you're an LGBTQ person, you want PrEP. That's your provider's job to listen to you and work with you. And if you're at risk, ask for that. There's no shame in that. You're being taking your own health in your own hands, and you're doing the preventive thing. So, and like you said, if you don't have somebody that you feel comfortable talking to about that, you better find a new person, because that's what they're there. They're supposed to be there to take care of you. And nothing would make me happier than somebody coming in, which we've had, and say, hey, I want to get on PrEP. That's great. So,
I've had the conversation. Yeah, I've had the conversation with folks before that, as LGBTQ folk, we go through this struggle at whatever stage in life, just to coming out to our friends, coming out to our family. And oftentimes we don't think about coming out to our physician.
Yeah. Right.
And so that makes those conversations that much more difficult, or if you're going to your physician, well, I go to my physician for a cold. I'm not going to my physician because I'm gay. But if you already have that conversation.
Well, and I think they worry about a stigma, because they think, well, even if they've come out and they're gay, they think if they say, I want PrEP, that they'll be viewed as being in a riskier lifestyle or whatever. Right. You need to have that relationship with your provider. They need to be there for you. And this is not a commercial for Health Right or what we do with Covenant Health or Run White. But if you're not in that situation,
right.
Reach out to us and we will get you connected to somebody. If we can't help you, generally we can. We're not going to turn anybody down for PrEP. We want to help people. We would rather be there for prevention than dealing with the aftermath of a diagnosis. And we've been on both ends of the spectrum. So I want to encourage people to be there, speak out, and be your own advocate. It's your body. Providers there for you. So don't, peg your corner and feel like you can't ask for that.
Yeah. And I'll just add to that I know it can be a difficult conversation to have, to come out to your provider, but not only is it important from, an STD standpoint, but there are so many conditions that we in the LGBTQ population are more at risk for. Mm-hmm. Lesbians are more, maybe higher risk for breast cancer and other malignancies. They need increased screening. We do have higher rates of smoking and substance use disorder in our population. So providers are trained, or should be trained, on LGBTQ specific health related issues. So and they don't know to talk to you about those things unless they know, what your sexual or gender orientation is. So it's really important to develop that relationship so that you feel comfortable enough to have those conversations. Well,
even like with the vaccine that's now has a broader usage, older population, just different things that I can sit here and think of as a provider based on sexual orientation, how I will be looking in terms of increased risk of things like HPV, et cetera. It's so important that we know that.
Yeah.
And again, I say, if you don't feel comfortable coming out, or you come out and you don't feel like you're getting the response you need, then you need to find another provider.
Well, I think Covenant House with
Yeah.
Dr. Rainbow.
Dr.
Yeah.
Rainbow. I was
Okay, you
just
want-
going to say that. With Dr. Rainbow, there are safe providers. And if you know of any safe providers, you can add them there.
Right.
It covers the state and keeps people. You have to be honest with your health care. You have to be.
Mhm.
If you can't be, there's safe ones on Dr. Rainbow. Look there and find what you're looking for.
Is it drrainbow.org or .com? I can't remember off the top of my head.
.org.
.org. Yeah, I tell you, I've referred many people to Dr. Rainbow, even when it comes to trans folks looking for hormone therapy, or just or folks just looking for a physician that won't turn them away, or they're worried, because they are gay, that their physician's not going to work with them. So, and I realize that it's not a 100% accurate, like this is, it's very much a flowing, a moving list, that can grow and change. But it's still a wonderful resource. And I will kind of plug Dr. Rainbow and Covenant House a little bit, because when Dr. Rainbow was launched, I know that there were two other, at the time, and please correct me if I'm wrong, but there were two other cities in the country. I think one was LA and the other one was somewhere on the East Coast. I want to say it was New York, but I remember hearing it was a larger city. And they were struggling getting their LGBTQ medical resource website off the ground. And here in West Virginia, Covenant House got one off the ground.
Yeah.
So it's leading in the nation with that concept of one place, like not to boil it down, but a one-stop shop for your medical, whether it's, a dentist, it doesn't have to be an HIV AIDS type issue. It could be any type of mental health issue, or you name it, ear, nose, and throat.
Yeah, I think a lot of doctors are very reticent to talk to their patients. We're talking about general practitioners here. They're reticent to talk to their patients about their sexual health, and sexual health is a very important part of a person's overall health, but they're reluctant to talk to them about it because they think their patients might react negatively. It's like, why are you asking me about that? I mean, that's very personal.
Right.
But it's something that, if you're sexually active, especially if you're single, this is something that doctors really need to talk to their patients more about.
Yeah. And I've told folks that even when it comes to the preventative medicines, the medications, that it's not just for gay folks. I mean, you've already, pointed out how does that work? Actually, that's a good question. How do the preventative drugs work for folks that may have contracted HIV through drug use?
Yeah, go ahead.
No, go ahead.
Girl.
Well, so, when we talk about what PrEP stands for pre-exposure prophylaxis. So that means that you're taking a medicine prior to an event occurring, so that established infection does not occur.
Mhm.
Post-exposure prophylaxis would mean that you're taking an anti-infective antibiotic after an exposure to limit established infection. So people who are at high risk for HIV acquisition would be candidates for PrEP. And there are three general groups of people that it's recommended for. One is for gay or bisexual men who have unprotected anal intercourse in the last 6 months, at least one time. Then you would be considered a candidate. It's estimated 1 in 6 gay men or bisexual men would be a candidate.
Yeah.
It's also recommended for people who inject drugs if they've shared their equipment in the last 6 months as well.
Mm-hmm.
So it ends up being like 1 in 30 people who inject would be considered candidates. And then the third group of people would be people who consider themselves heterosexual but have multiple risk factors over an ongoing over the last 6 months. So if they have multiple partners, or they have multiple partners and their partners are injecting drug users, then those individuals would also be a candidate. It ends up being like 1 out of 200 every heterosexual people would be a candidate for PrEP.
Yeah.
So they're all used as prevention, and we have the best data with the sexual cases of using it for prevention. So it's like can be up to 90% effective in prevention in people who are gay or bisexual men. For injecting drug users, the efficacy data is a little bit less. We're not really sure why that is. It's like 75% effective in preventing cases. And this is assuming that all people are, they're adherent. And that's another important point, is that right now the duration of PrEP, and this involves taking a medication every day, a single tablet of medication, is taken throughout the duration of the risk period. So if you're somebody who's single and you're a gay man and you have had receptive anal sex, or you're having multiple partners, then you would take that PrEP for the duration. Let's say you got married, or you're monogamous with one person, and you know that their status is they're negative and they're not having sex outside that relationship, then your risk becomes much less, and then you may not need to be on PrEP.
Right.
So it's for the duration. There is also a growing, there's data that's emerging that's more of on-demand PrEP, so that it would be medication that would be taken prior to, a weekend where you're anticipating being sexually active. But it's currently not, the medicines are not FDA approved to be taken that way.
Mm-hmm.
And there's more data that's coming with that. But so those are kind of the 3 groups of individuals where it's recommended, and then that's the duration. It is 1 tablet a day. The other thing that I would add to that PrEP conversation, when we talked about access and who can prescribe it, another concern that a lot of people have is the cost related to it.
Right.
They are expensive. Right now, there's 2 medications that are FDA approved for PrEP use. One is the older drug is called Truvada,
Mm-hmm.
and it's a combination of 2 medicines that we've used for quite some time. And then there's a newer version of Truvada called Descovy, that one of the medicines that's in it is sort of a modified version of one of the older drugs, and it has a better safety profile in terms of being less harmful on kidneys and bones.
Yeah.
So it does have that advantage. However, at this point, it's only FDA approved for people who were born biologically male. So it's not that women that have a vagina, there's not as much data with the pharmacokinetics of Descovy, and so Truvada should continue to be used in those groups of people until we know more about the pharmacokinetics.
Right.
But anyway, in terms of cost, if you're concerned about that, and if you go to the pharmacy and you have a prescription for Descovy or Truvada, and you come back, your copay ends up being like $700 a month or something, and you freak out and you're like, there's no way that I can afford that, call somebody. You can call any of us here that's on the line, and we know how to navigate the payer system. There's patient assistance programs with the maker of Descovy and the brand version of Truvada, that based on your income and assets, you may be eligible for free medication or for help with copays. So there are avenues. Truvada is now generic. So we anticipate that the cost is going to be coming down, as time goes on. So there are avenues for people to get financial assistance for the medication as well.
Yeah.
Or Andrew, do you have any other comments about that? Or
well, I could not help but notice that on Facebook, the comment section on your Facebook window, there have been some people that have been saying hello and offering some questions. Like one person said, Dr. Teague, are there any combinations of drugs, not one pill, that would qualify as effective?
For established HIV infection?
I'm not sure whether this pertains to PrEP or not. It may pertain to PrEP.
Okay, so PrEP, there's only 2 medications that are FDA approved for PrEP at the moment. One is Truvada, the other is Descovy. They both have two different medications in them, but they are both 1 tablet daily. That's the way it's FDA approved. And I apologize, I don't have, I'm using my device for Zoom, and I can't see my Facebook at this point. So are there other questions that you can see, Chuck? That
what about you, Chris? Can you see the comments on the?
I'm looking at, someone just mentioned here about just spent several hours today with their insurance company trying to figure out what they actually qualify for drug-related for PrEP. He was told that brand only and the costs accordingly, but now he sees that it's substantially low compared to the regular costs because he has insurance. And it says that he can't qualify for programs like Ready, Set, Prep, but his healthcare provider's supportive. And, even with that, and I think, Christine, you alluded to this, I have friends that are on PrEP and they do have insurance and they have a copay, but then they also deal with the manufacturer. And because of, and these are folks that, maybe are not, low income necessarily, but the manufacturer even gives them a discount. And there are many folks that I know that get it for $30 a month, and some still get it for free between insurance and the help from the manufacturer.
Right. Well, I would encourage anybody that wants the drug, maybe has the prescription or whatever, and having issues obtaining that, to call our clinic. I have somebody on my staff, my clinical coordinator, who's like a guru of accessing patient assistance programs, and Christine's in and out of there all the time. So I would encourage them to call our clinic. It's 414-5930. Ask for Rhonda. Tell them Angie sent you. She is the expert, and Christine will tell you, like if I have a patient with an access issue, or if they have insurance or their copay's high or whatever, she is the lady that always gets to check into that, because she's been with me over 20 years and really knows how to navigate and access systems. So I would encourage, don't go without.
Yeah, and I know that Gilead they have an 800 number, or you can go online. I think it's advancingaccess.com or something like that. Yeah. But they have people that are on standby, 24/7, that you can basically, you tell them what you have, and they can sort of point you in the right direction in terms of, what's available in terms of assistance. So there's lots of good, so there's.
I think early in the day when people were, contracting HIV and everything like that, way back in the day, insurance companies were kind of reticent to, cover the medication for people with AIDS. And I think it's the same thing with PrEP now. I mean, more and more insurance companies have said, hey, look, it's a lot better to cover these medications than, pay for hospitalization,
Right.
Because everybody knows that going into the hospital is more expensive than anything. And one of the things we're trying to do here in West Virginia is letting people know that help is available, that we will get your medications to you one way or another We just want to keep you out of the hospital. And I think PrEP is a part of that.
Absolutely. And just to add on to that, in terms of, in addition to PrEP, that's what the Ryan White program is there for, is to make sure that, for at least for moving beyond prevention, but to treatment and care,
Right.
is that no matter what you have, if it's a medical card or you're completely uninsured, which is becoming more of an issue now, or Medicaid or regular insurance, even if you have the best insurance in the world, they don't always cover everything that's involved in your care. And that's what the Ryan White program is there to do, is to really serve as the safety net, to make sure that the comprehensive care is there. And so there should be nobody in the state of West Virginia who is at risk or who has HIV infection that should go without. There are assistance programs out there. And I hear horror stories of people who, you know, they found out they were HIV positive, you know, 5 years ago, but they never accessed the healthcare system because they thought there was no way in the world they could afford it.
Yeah.
And that is absolutely the worst possible thing that could happen. Is we want people to get engaged in inner care as soon as possible, and that's
well, Christine, you are familiar with the AIDS Drug Assistance Program.
Absolutely, yeah. And so, what Chuck is referring to is one of the Ryan White buckets, so to speak, is the AIDS Drug Assistance Program. It's called the Part B program. Every state has an AIDS Drug Assistance Program, and our dollars that get funneled into the Part B programs for every state is based on caseload. So it is allocated based on numbers of people who identify as being HIV positive, testing positive in a certain jurisdiction or state. And overwhelmingly, the largest portion of Part B funding goes to help support the cost of, or it used to be the cost of medication. Now, ADAP is set up and they do a lot of, instead of actually paying for the medications themselves, if you qualify financially, they will help support insurance premiums for folks, because it's actually more cost effective. So we don't, you know, if people are completely uninsured, then the ADAP program can help with the cost of medications. If people are insured, but they have a significant financial difficulty paying premiums and deductibles, the Part B program can help with that. And then Part C,
with the COVID pandemic and HealthRight has seen a huge increase in demand for, you know, a lot more people unemployed. You know, we've lost a lot of the, you know, even local artists or people who never would have accessed care at HealthRight before maybe need to do that. So I would like to just touch upon the fact that that if you haven't done that and you need to do that, we welcome you. Like I said, we're very LGBTQ friendly. I know a lot of times if you've had a provider and you have insurance, you suddenly lose it. People are tempted to not access care or go without because it's a change. So I want to just encourage anybody out there who would, you know, now qualify because they're uninsured, or maybe somebody's now qualifying for Medicaid that didn't before, but especially the uninsured population, because sometimes the access is harder there. If they've had like a doctor they've been going to and they have insurance and suddenly they can't because they don't have insurance, we would want them to know that they are welcome in HealthRight. We have a lot of patients, trans, like I said, LGBTQ, everything, XYZ, every color, flavor, they're welcome. And we want to make sure people know that, and that they're not fearful. Again, like Covenant House, we have the clinic at Covenant House. They're more comfortable because they know Covenant House and they want to go to our clinic at Covenant House. They want to go to our 1520 Washington Street location, you know, do that. And we just want to make sure you realize that we're there for you and that we welcome you. We don't want ever to have anybody to be fearful in terms of accessing care.
Well, HealthRight's a wonderful resource for the community. It really is. And I want a couple things that I think would be, I mean, everything we're talking about is beneficial, but I want to talk about not only testing, HIV testing, but also beyond that, I want to talk about what it means to be undetectable. Because I think there's a lot of confusion. I had someone ask me recently what undetectable means, and this individual has a family member that I know, is HIV positive and undetectable, or maybe I shouldn't say and, but I think we can talk about what it means to be undetectable. But as far as testing goes, I know some folks are apprehensive sometimes. This is like an Oraquick, not that I'm advertising or promoting any particular product.
We do.
And
we're putting together, right now we are involved in putting together a home testing outreach in which, it's not right, it's not in place yet, but it's in my office, we're putting together a project in which people can get in touch with us and request a home testing kit, which is, it's the same thing that you could buy at Walgreens. Sure. It's a Oraquick kit. It looks like a little cigar box. You open it up and you test yourself. And we think a lot more people could get tested if they can do it at home.
Yeah.
We also, and we have for the last probably 5-6 years, we give out the Oraquick test kits at the clinic, no questions asked, at the window at the outpatient care center.
Wow.
Yeah.
So if you come, you don't have to be a patient of ours. You just go to the window and say, I'd like a test kit. And they give you the test kit along with instructions and, important points about what the window period means and what happens if you have a positive result, what do you need to do, so that goes along with it.
Is that on Wednesdays?
It's Monday through Thursday, 10 to 3.
Okay.
So we've given out probably 400 or 500 kits over the last several years. We do, once they go out the door, we don't track them or anything like that. It's anonymous, so we don't take your name or anything when you come in for the test. So it's really up to you then to take the kit, to do the test in the convenience of your own home or wherever you want to do it. And then it's up to you then to contact someone about having, a confirmatory test and getting linked to appropriate care after that. But it's a very simple mouth swab that can be done in 20 minutes. There's really not, and it really is, instructions, when I say, a child could do it, probably they could do it. It's very, very, very simple.
My last HIV test was one of the at-home. I think it was the same one Chuck's talking about. It looked like a cigar box. I was actually quite impressed about all the information in there.
It's the same, the little packet that you put up that Oraquick. Mm-hmm. It's the same kit. It's the same. It has a little testing tube and a little paddle, and it's put in the little cigar box with the step-by-step instructions.
Yeah.
So I think I have one. Let me go get it. I'll show you what it looks like.
Love it. Well, it's so important for folks to know their status, because we hear too often folks that don't know. And that should be a conversation, especially if we're talking about, from sexual activity, those are conversations that should be happening. If you're intimate enough with somebody to go that route, hopefully you can have the conversation about your status.
Yeah. Chris, getting back to one of your earlier comments about the whole concept of being undetectable.
Yeah.
Right.
When somebody who knows that they're, they know that they're in HIV positive, and one of the first things we want to do is get them on medication right away. They, follow their doctor's advice, they take their medication. They usually go into for a checkup maybe twice a year or so, and they'll do blood tests to see, what their immune system is like and what their viral load is like.
Okay.
And when people who are on HIV medication have been stay on their medication long enough, their viral load goes down so low that they
Mhm.
are clinically incapable of transmitting the virus to other people. There's a little kind of a formula that I've seen called U equals U. Undetectable equals untransmissible. And there have been plenty of studies that have found out that when a person has an undetectable viral load, they are virtually incapable of transmitting the virus to other people.
Sexually. We're not exactly sure that undetectable equals untransmittable in injecting drug use. I'll
Right.
just throw a
In
caveat in.
injection drug use, that's a difficult question.
Yes, but I think for a lot of people that are listening tonight that are concerned about the sexual aspect, and what a wonderful thing that we have now, that we can actually get people to that low of a level that you can't give it to somebody. I mean, that's just really, it's a great, wonderful thing. But you have to get on the medication to get to undetectable. And that's why it is so important that as soon as you know your status, you get linked to care immediately. You don't wait around. There's not only is there that benefit to you personally for your health, but there's that public health benefit to doing it immediately. I have the test kit. This is what it looks like. This is what we give out at the clinic. I think this is what Chuck is talking about that he's going to be starting to give. This is the box that it comes in. So it's about, the size, again, like the size of a cigar box. And then you open it up, and the little box looks like this. And it opens like this. And you've got step-by-step instructions that you just, go through one page to the next. It requires, I think, an 8th grade reading level. And then literally the only two components of the test itself are the swab and the reagent. So you open the reagent packet. This is what it looks like. This is the same test that we use in clinic settings or mobile outreach. The only difference is it's marketed for over-the-counter use, and it comes in a fancy packaging that looks in that big cigar box.
Right.
But it's the same test. So this is your little test tube. And then this is the test paddle that you can use either an oral specimen as your what you're testing, or you can also use this, not the home version, but we use it in the clinic or in outreach. You can use a blood sample. So you get your finger pricked, and that's the sample that's being tested. But what we're talking about here in the home kit is an oral swab. So to do this is what the swab looks like. You're just gonna swab your upper gum and lower gum one time all the way across like this. And then your little test tube thingy, doohickey. This paddle goes in the reagent, and there's a little holder where in your cigar box that you can place it, and you set your timer for 20 minutes, and you actually read the result after 20 minutes, between 20 minutes and 40 minutes. If you're going to do the mouth swab, it's recommended that you don't brush your teeth or have mouthwash or eat or smoke or drink anything 30 minutes before. There should be at least 30 minutes after you've done any of that before you swab your mouth. And then to read it, you're just looking for lines that show up right here. It's like reading a pregnancy test. I don't know how many of you have done women out there that have done pregnancy tests. Here, in a pregnancy test, you'd pee on the stick. You're using your mouth specimen, but there's going to be a line that shows up that says C, and that's going to means that the test is good. And then if that's a positive test, you're going to see a second line that says where the T is. So it's very, very simple. if you would get that result, then it's actually a very good test. It's very sensitive and very specific, but you still have to have a confirmation test done. So you need to reach out to either your doctor, or your healthcare provider, or the Ryan White program, or HealthRight, or somebody that can do that additional step for you and get you linked to care immediately. But it's a wonderful technology. It's very simple. There are other what we call rapid tests that can give you results in a matter of. There's even one now that you can get your result in a minute, and then there's others that take 20 minutes. But they're all a little bit different. This is the only one that's approved for home use, and that's it's the OraQuick over the counter. So if you need one and you want to be screened in the privacy of your home, Chuck can help you, or we can help you at the Ryan White program and hook you up with a free kit that you normally have to pay about $40 for it at the drugstore.
And the accuracy,
and when you're using an oral specimen, it's thought to be 92% sensitive, which means that if you took 100 people that were positive, 92 of them would have a positive result. So you have 8 false negatives. It's almost 99.9% specific, which means if you took 100 negative people, over 99 of them would be negative. So less than 1% false positive. So it's very, very good. And all of the FDA approved kits have their sensitivity and specificity rates are all, very high like that. The one thing that I will mention with all of these rapid tests and that we do, they're considered antibody tests. So that means, and when I mentioned that window period earlier, after you've been exposed, either sexually or through blood exposure after sharing a syringe, you're not going to make antibodies immediately. Most people will make them within 4 to 6 weeks, but we consider the window period for these tests to be 3 months. So that means that when we counsel people when they have this test done, if you've had a recent exposure in the last 3 months that you're concerned about, whether that's an HIV or a sexual transmission exposure or a blood exposure, this test may not pick the antibodies up yet. You need to have it done again in 3 months. There's no test that's out there that you have sex on Friday, Saturday, you're concerned about it, you want to be tested. There's no test out there. Antibody test, antigen test, PCR,
Right.
There's nothing that will pick it up that soon. So that's really important for people to understand.
Yeah. I'm glad you brought that up, because that was going to be one of my questions also, is like, what's the window? And then also, is there a recommendation? I know I've heard a recommendation, but for how often someone should get tested? I know I know folks that regularly, they're sexually active, they regularly just get tested. They don't necessarily measure it based off of, 3 months or so from the last time they had any type, of possible potential exposure. But, some folks do it every 6 months, some folks do it, is there a recommended?
I think it's, on an individual basis, a case-by-case basis, and you look at your risk factors. Sure. If you're someone who is not sexually active and you never come in contact with blood, then you never need to be tested. I mean, your risk is really, really low. If you're in a monogamous relationship with someone who is in a monogamous relationship with you, you both know your status, then you're going to be very low risk. If you're concerned, maybe your partner's not being 100% monogamous with you, then you probably want to be tested more frequently.
Yeah.
In general, I would say that if you have, more than one partner and you're concerned about sexual transmission, probably every 6 months is reasonable.
Yeah.
If you're someone that continuously uses substances, we actually recommend that they do it every 3 months.
Yeah.
Just because
Yeah.
you want to be able to identify people very early on.
Yep.
Yeah.
I agree with Christine. Yep.
Yeah. Is throughout the entire COVID crisis, and I mean, not that we're completely through it yet, but I've seen and read and heard on the news just so many comparisons with, obviously transmission is different, but why were there comparisons with COVID and HIV? Because of the, was
From
it
a biological standpoint or more of a social standpoint?
I guess either, but or maybe it was just, even you'd hear Dr. Fauci even mentioning at times things they learned off his HIV/AIDS research,
Right.
and how that even kind of applies with COVID.
Yeah,
Well,
if you're talking about somebody who's immunocompromised,
Right.
then they have to be very, very, I mean, we should all be
Right.
very careful about, our exposure to COVID-19, but especially for anyone who's immunocompromised. Yeah, anyone who is HIV positive right now, we are, let me see here. We are telling people, we're putting together a newsletter in my office saying that anybody who is living with HIV should have at least a 30-day supply of HIV medication available, should still avoid contact with people who are sick, practice good hand washing, avoid large crowds, avoid non-essential travel, follow recommendations made by local healthcare officials, and establish a clinical care plan to better communicate with healthcare providers online or by phone. And I think the Ryan White Clinic has been doing a really, really good job of establishing contact with people who are in their clinic, who are, coping with this shutdown.
right. As soon as we knew that this was going to be significant, we immediately got on the phone and we started calling everybody to let them know what this was, how it presents, what are the symptoms, what are the danger signs, when should they seek emergency care, and that we were transitioning towards another model of care, which is telehealth. So patients, initially, all of the care was being provided either on the phone or through the CMC 24/7 Care platform, which is a telehealth platform that offers not only audio conferencing, but video conferencing as well. And as Chuck was, talking, being immunocompromised is, that's a setup for potentially, a worsened complication rate of COVID. We don't know necessarily that somebody who is, by merely being HIV positive, that increases someone's risk. But surely, we know that if somebody has a very low CD4 cell count, either, they're newly infected and they haven't had a chance to build up their immune system yet, or some people just maintain very low CD4 cell counts. Those people could potentially be at higher risk. That's established. But certainly a lot of our patients who are HIV positive have a lot of the other risk factors that we're seeing as being most problematic for the routine population. So if you're diabetic or you have cardiovascular disease, you're overweight, you smoke, you're over 70 years of age, then those are the things that are really going to impact your ability to, fight this and have a more mild presentation. We are now seeing patients back in the clinic, but we're offering people the option of doing telehealth, particularly if they live far away from us, if they have far distances to come, or they're very immunocompromised, or they have a lot of these comorbid kind of conditions, then we're still doing telehealth. But I think it really depends. I don't want people to just think, oh, I'm HIV positive, I'm gonna really get really sick from COVID. I think you need to look at the other things. If you're somebody who's HIV positive and you've got a great CD4 count, and you're a younger person and you don't smoke and you don't have any of these other things, then you're probably going to be you're probably, if you get this, you're probably just going to have a milder case. It's those other things on top of that that can really, you know, end up with a worst case scenario.
Yeah.
So right now, the biggest message I can give you is make sure that you get, if you're HIV positive, get your HIV under control. But then the other things, you know, exercise, eat well, get your blood pressure under control, manage your diabetes, lose some weight if you need to lose a few pounds. Because those are the things that are going to keep you healthy as we, you know, we're going to be in this probably for another year or two. So it's not like, I mean, we're just starting, you know, dealing with this. There's still time for people to make those modifiable lifestyle adjustments that can really make a difference in the coming months.
Is there, with the upcoming, you know, June 27th being the HIV testing day, are there, other than just trying to increase awareness and encouraging people to be tested, is there, are you expecting, or do you traditionally on HIV testing day have more people come in to be tested? Or is this the first time, because I'll be very honest with you, and shame on me if it's been going on, but I haven't necessarily, to my recollection, and again, I just turned, you know, we're not going to talk about my birthday, but the older you get, the less I seem to remember, but so is this just a push that we're really trying to convey now? Or have we traditionally had more people say, hey, you know, yeah, like it's like a coming out day, like, you know, let's talk about it and let's encourage you to do this on that day and be aware of it.
Right.
Yeah.
National HIV Testing Day has been going on for, I don't know, over 20 years.
Sure.
But we've never had to deal with this kind of situation.
Yeah.
And so we're always encouraging people to get tested. And if, you know, right now I am working from home.
Yeah.
But if somebody from my office, we do have kind of a skeleton crew at my office that are, you know, keeping track of COVID-19 cases and so on. If somebody called me up at my home and said, you know, one of our disease and investigation specialists have determined that there's somebody that really needs to be tested. They had sex with somebody who is HIV positive, and we really think they need to be tested. Could you call them and could you test them? I would say, sure. I would just go to my office, collect my equipment, or a quick kit, or right now there's another test that we use called Insti, which is really great. But I would get my mask, my gloves. I visit them at their house if they need to be tested. I don't really have a worry about that. We are still promoting HIV testing and still getting people tested if they need to be tested. You know,
we've historically usually done some sort of testing event around the date, you know, June 27th. We haven't planned for a mass event like that this year. I will say that, you know, we are at Covenant House every Tuesday and Friday morning testing.
Okay.
So we'd like to recognize the day that's the testing and, you know, to have that conversation and we're talking about it and to let people know if they want to get tested, come to Covenant House Tuesday and Friday. Every Tuesday and Friday we're there.
Right.
And then I'm hoping that maybe when we have our Pride Parade and Festival in September,
Right.
then we could say that, you know, we're honoring HIV testing day, but we're doing it in September this year.
Sure.
And that way, you know, we could do more of a mass type testing.
Well, I believe, was it Covenant House last year did some testing on site at our parade?
We did. Ryan White.
Ryan White.
White died.
Gotcha.
Yeah.
Gotcha.
Yeah, and I know the state has had a presence there before doing testing. So yeah, we'll work that out. Somebody will be there doing testing. Yeah, in September.
Well, folks, we've been at this for over an hour now, and there's so much more we can and could talk about. But in closing or ending our conversation, is there anything else that anyone would like to kind of add to the conversation? Or?
I would just like to let you know that my test is negative.
Know your
I was
status.
worried.
So I'm in the good. You can't really see that probably, but there
If
is
it
a
came back
line.
positive, we would make sure that you get into the
Oh,
care
you
meeting.
I would get me linked to
Yeah.
care immediately. Yes. I love you guys. I know you take good
Well,
care.
we did want to talk about, we talked about for anyone here, is we really want to promote HIV testing as just another vital sign of blood pressure, temperature, weight, HIV status. We feel like we've come a long way in terms of testing and in our community, and those that work and do this day in, day out, like Christine. We want to promote that. So we really hope that comes across in the way that we deliver care and how we interact. So you can bet yourself that Covenant House, Health Right, and Ryan White are 3 safe places to go and be tested, and there's no stigma attached at all, and we want to encourage people to do that.
And insurance isn't necessarily a barrier for folks. That's
Nope.
important. Yeah.
Absolutely
No.
not. That's what we're there for.
Get tested. If you don't have to get tested, it's really neither here nor there.
Yeah. Well, that's wonderful. Well, thank you all so much for being part of our chat today. I appreciate everything that you all do for us, and I appreciate you being here with me. And actually, I'm excited to talk to some of you a little bit one-on-one, because Christine and I haven't talked before. Chuck is a former Power of One award winner with Rainbow Pride of West Virginia. And so he is a hallowed name in the Pride office. And Angie, this is the first time Angie and I have really communicated, so I'm excited. And Kay, I already told everyone she's my guru. I'd say she's my spiritual advisor, but I don't know that she wants that heavy of a responsibility for me. But I'm really excited, and thank you guys. And anyone that's watching, if you want more information, or if you just want to reach out, I mean, whether you reach out, CAMC, the Ryan White program, and Christine, is that primarily at Memorial, or do you have a specific clinic?
Our clinics are in the outpatient care center, which is on the 4th floor of the Heart and Vascular Center building at the Memorial campus.
Gotcha. Wonderful.
Yeah. And then for anybody on Facebook, if they need, because I've gotten into long Facebook chats with people that are worried about all kinds of things about their risk and everything like that. All they have to do is look up Chuck Anz, A-N-Z, and they will find me on Facebook. And so I encourage anyone who's watching this to get in touch with me if they have any questions at all. And Angie and Kay and Christine, and especially Chris, I mean, you all do such wonderful work. Thank you so much for all you do.
Thank you.
Thank you.
Contact me at the clinic at 414-5931. That's my direct extension. I'm also on Facebook. Angie Settle. I filled a lot of questions through chat if people are comfortable with that. My email is asettle, S-C-T-T-L-E, wvhealthright.org. So would welcome any questions or anything that you all want to bring my way.
And since you're recording this, my toll-free number is for the West Virginia HIV program is 1-800-642-8244.
Oh my gosh, that's a wonderful PSA. I love it.
Or at Covenant House, it's 304-344-8053.
And thank you, Covenant House, for entering a window display competition for Pride Month. I was really excited to see your submission. We had, I don't know if the rest of you know, but we've worked with Festival for the first part of this month, where we encourage businesses and organizations to decorate their storefront or a window front using the colors of the rainbow to help the city with a work of art. So Covenant House was one of our entries, and we were excited to have Covenant House part of that too.
Awesome.
Yeah.
Well, guys,
I like how that's worked out. I mean, I love all the advertising that's the rainbows all over town. It's great.
Yeah, I love that.
Well, folks, thanks a lot. I'm going to end our chat now. And I can't wait to see you all in person.
Thank you
Yeah.
for organizing this, Chris.
All right.
Thank you.
Bye-bye.
Good night, guys.
Bye-bye.